this is Dr. Ben Barton in Columbia, South Carolina again. So the question now is, who is a good candidate for the therapy that we provide? Who is a good candidate for decompression therapy? And it's a good question. The answer is, if you've been diagnosed with disc herniation, degenerative disc disease, sciatica, spinal stenosis, facet syndrome, those types of diagnoses, you may be a good candidate for the therapy that we provide. So what we want to do is say, okay, how do we determine that? And that's a good question. The answer is, well, for starters, the exam. What does the exam show us? What does the case history say with this patient? And then we correlate that with either x-rays or what's even better is an MRI. And those are the definitive tests that we can run to show us what that MRI the MRI will show us what the disc actually looks like, or the degenerative disc disease or the disc bulges. Also, patients that are great candidates are the patients who have tried all the other forms of therapy for their spine and it didn't work. For example, injections, physical therapy, chiropractic care, exercise, those things a lot of times can aggravate disc herniations. And so if you've tried those forms of therapy, it didn't work, and then if a surgeon has said, listen, you need to have back surgery, then obviously that's something you want to say, well, let's see if there's anything else. Are there any alternatives? Because back surgery should be the last ditch effort. You should try anything before having back surgery if you can, just because it's a very aggressive intervention that you would have. So that's what we want to say is, okay, if you've been diagnosed with those kind of conditions and you've tried other forms of therapy that didn't affect you in a positive manner, then you would be a good candidate for decompression therapy.